is already very worse, and we are seeing. I have not seen this type of situation ever in my lifetime. That people were struggling for oxygen. I have not seen that people are standing on roads and showing their oxygen saturation. That see, doctor, our oxygen saturation is so low. Please provide us oxygen bed in the hospital, or please provide us some help. But we were so helpless that all the healthcare infrastructure is overwhelmed. All the beds are fully occupied. Even inside the hospital, when I am inside my ward, I have to make life and death decisions within seconds, because so many patients are on oxygen. So we have to decide whom to put on ventilator, whom to keep on oxygen. So it is a very, very difficult situation. And as we are seeing that now, more and more patients are getting infected. So I am thinking that if not active intervention was done, then the coming days will be very, very difficult. Uh, all those countries who are supporting India in this situation is obviously very good, and our government also welcomed all the steps done by other countries to support India. But the thing is that the main active support or the active intervention can only be done by Indian government. And if more and more healthcare infrastructure is developed in a short period of time, if oxygen supplies are adequately provided, so that all the industrial use of oxygen can be halted for some time and all will be used for medical oxygen, and isolation centers is developed, and more vaccination centers can be developed in a short period of time. So all these things are like, they need a very strong commitment from the policymakers, and if this can be done at government level, then any support from other countries will be helpful. And this, I want to say that any support by anyone will be life saving in India. Very difficult. And we are like, when it is very difficult to counsel them to go for another hospital or search somewhere else. And even not only that, they are searching for hospital beds or they are searching for oxygen, and they are managing their patients at home. And when even I am supervising or treating many of the patients who are at home, I attend calls for them and manage them at home and tell them what to do and not to do. So all these things we are doing as a healthcare worker, and it is very exhaustive and traumatic also to maintain all these things at this moment of time, because whether we are on duty or we are off duty, we are continuously working for the patients. We are continuously either attending calls or in wards we are attending patients. So it is very exhaustive, and it will become very difficult when we have to turn some patients, then tell them that please find out some another place to get your patient admitted. Because the first thing they thought that because they have developed a vaccine, and now vaccine was promoted as a treatment rather than being a preventive measures. And second thing, that the patient load was also decreased at some time, like in December and January. Patient load was also decreased, so they thought that we win over a virus, and now we can continue with their daily lives. And even the people have laxed their adherence to the COVID appropriate behavior, or they stopped wearing masks. They have started mass gatherings. So everything was gone so wrong that within few months we again came to this situation. So that's why I just want to also add one thing, that even I am now seeing people who are had COVID infection last year, also have 2 doses of vaccine, but still got infected by this virus. So the thing is, we have to keep in mind that this virus is mutating very fast. It is learning new and new ways to invade into human system and causing infection. So we all should follow COVID appropriate behavior as much as possible and avoid mass gatherings. This must be a learning lesson to all of the world. I'm very much concerned as a healthcare worker, because I want everyone should be vaccinated as early as possible, because if you get infected after vaccination, the infection is very mild and it has a protection. So everyone should vaccinate it, and I am much more concerned about, first and foremost, for the Indian people, that everyone in India should get vaccinated as early as possible. And after that, the whole world, I know that everyone is dependent, as you already said, that it is a pharmacy of the world. So everyone should get vaccinated, and because every life I have seen people dying on roads, and it is very difficult to see them die because of this infection. So they all must get vaccinated. This is must, yes.